Good morning, everyone. And on behalf of the Los Angeles County Economic Development Corporation, welcome and thank you for joining us for this special webinar, Safer at Work, Steps to Reopening Your Business. We have an impressive program of presenters and panelists with representatives from AECOM, Nixon Peabody, Servicon Systems, and the LAEDC's very own Business Assistance Program, all of whom will be sharing their tips and strategies on how to be safer at work. Now, I'd like to introduce the CEO of the Los Angeles County Economic Development Corporation, Bill Allen.
Thank you, Shane, and good morning, everyone. Welcome to our LAEDC webinar on how we can all be safer at work, reopening our businesses. Steps to reopening our businesses are proving to be more complicated than some of us may have thought. Witness some of the rise in cases in recent days, the fact that we've had to shut back down our bars. The LA economy is an enormously diverse and complex economy, a truly globally competitive economy that prior to COVID was generating over $700 billion a year in economic output. It's a very diverse set of industries. There are a lot of complexities with operating this economy. And so it's important that we carefully go about the business of reopening the sectors that had to be shut down to slow the spread of the virus. Just this past Friday, the board of directors of the Los Angeles County Economic Development Corporation, the LAEDC, established a new mission to guide our new 3-year strategic plan as an organization. That mission says we are about reinventing our economy to collaboratively advance opportunity and prosperity for all. Today's presentations are a perfect example of how we intend to approach this work. One of the key strategies identified by our board is our power as a convener and as a source of objective information to help all of our regional stakeholders take part in the reinvention of our economy and the way we do business, to enable more than just the reopening of our businesses, but the creation of a growing, equitable, sustainable, and resilient economy that supports a healthy and high standard of living for all. Our presenters today are leaders in their respective industries and authorities on their various subject matter areas, and they will provide us with valuable insights and strategies for reconfiguring the spaces in which our businesses will operate in this post-COVID world, for helping our enterprises understand and mitigate the potential legal liabilities that exist as we welcome back our employees and the public. And finally, how to provide safer, cleaner, and more sterile environments in our offices, our manufacturing facilities, and our healthcare institutions. Along the way, you'll hear from our very own Barbara Levine about the work we're doing one-on-one with so many small businesses across the region as they go about reopening their enterprises. Working with all these partners is an example of how we will collaboratively advance growth and prosperity for all the residents of this LA County region. So because they have so much value to offer, I'm going to keep my opening remarks short and begin by introducing our first speaker. She is part of a global organization we are very proud to have headquartered here in Los Angeles, and that is AECOM, the world's premier infrastructure firm, where Kelly Bacon is the America's Workplace Lead for Strategy Plus, a strategic business practice within AECOM focused on the relationship between people and the design of physical space. Kelly has 21 years of experience helping clients navigate complexity as they seek to create better, higher performing workplaces. Her education and behavioral research methods combined with her diverse project experience enable her to provide a broad societal context for working environments while developing detailed tactical action plans for her clients. Kelly's dedicated to multiple areas of research affecting today's knowledge worker, including technological disruption, the rise of co-working, and cognitive ergonomics. I'm delighted to be able to turn our Zoom platform over this morning to Kelly Bacon as she provides her insights and recommendations related to the physical spaces we occupy as we reopen our businesses. Kelly, the platform is yours.
Thank you so much, Bill. It was a wonderful introduction, and I'll share it's essentially what you just described my role up until the onset of COVID-19. And I think like many others on this call, all of our day jobs have shifted slightly. And I will share, and thank you for the broader introduction of AECOM. We are one of the world's largest preeminent AEC firms. And what you described in the practice of Strategy Plus, the types of consulting that we have and do, what you also saw in the text there is really just a broader approach with occupier strategies. So really just understanding human behavior in the built environment and the relationship between the two and better tying them in. As part of the multidisciplinary platform that AECOM has, one of the things that we have done and we've been privileged to be able to do is we have so many different disciplines and subject matter expertise under all of these different umbrellas. And once the gravity, candidly, of the situation really emerged end of February and March, one of the first things we did was create a transdisciplinary steering committee that has been meeting daily since late February. And that has representatives from the business line I'm part of. My group is part of the buildings and places, which is essentially all the ground up, right? Well, buildings and places. So architecture, interiors, engineering, our practice, et cetera, along with representatives of our environmental business line. As well as, I've been very grateful to learn a lot from my colleagues in the certified industrial hygiene space, which have been focused on biocontainment and contagions for the entirety of their career. So it's been a really, at the risk of sounding, well, how it sounds, it's been intellectually stimulating and a really learning experience for all of us to be able to put all this cross-disciplinary thinking together. And so if you wouldn't mind going to the first slide, what I recognize that everybody, all of our clients, all of our colleagues, all of our peers are inundated so consistently with information, and it's warranted because the situation is continuously evolving, but there's so much information out there that we found that we ourselves have struggled to track it all, and we certainly know our clients and our partners, et cetera, have. So the first slide I'm showing here is really as simplistic as I could summarize, as we could summarize a very complex scenario. When you start to think about reoccupancy, and some of you are already reoccupying, and quite frankly, some maybe haven't ever left, right? The critical on-site employees, et cetera, but some of the businesses that are evolving. So this slide and the next two slides are, the following slide are typology agnostic, meaning it applies to any type of space. And it's really kind of three buckets that we've been advising folks to address. There's the operational, which is the functional processes, science-based, that gets into procurement audits, cleaning protocols, et cetera. And then there's the change management. Now, I know that's a kind of a broad term and not everybody's either familiar with it or even necessarily comfortable with it, but that's really the behavioral aspect, because the people are a critical part, the occupiers are a critical part of the strategy, and their behavior is as important, if not more so, than the next and final bucket, which is the physical modifications, and understanding what those are, what the potential can be, and then, of course, identifying the proper funding sources through various stimulus packages to cover it all. So thank you, Shane, for moving it ahead. So, and also for anybody who's participating, we can send this deck out. It's also available on our microsite. So this is just a little bit more detail in terms of what those operational, behavioral, and spatial processes are. So I already touched on it a little bit in terms of, the operational, and that's really about what I believe one of my other colleagues on this call will get into in terms of the certified industrial hygiene, the proper chemicals that need to be procured that are truly disinfection rather than, simply cleaning, right? There's a lot of kind of misinformation out there. So it's the identification of those chemicals. It is working with facilities teams and procurement teams, maintenance teams to make sure that they have the proper processes in place as well as the proper materials. And then starting to get into some of the building systems and understanding what is plausible and then what's practical. I'm going to jump to right here in terms of the spatial, because I want to end with behavioral, again, emphasizing how important that is. But when you start to get into the spatial, there's a lot of ideas out there. There's a lot of kind of magic wands, quite frankly, that people are hoping for and reaching for. But really the key is still existing with the physical distancing. As much as, there is experimentation with UV lighting, but there's, that just isn't confirmed yet. And there's a lot of other kind of materials out there, but the key element is that physical distancing it's, really what we've been doing a lot of is kind of supply and demand planning for a lot of organizations, companies, et cetera, to really determine that maximum capacity at any one time. And then we are adding stacks and panels, really essentially kind of plexiglass and whatnot to help with mitigating some of the airflow. And we can get into that more in the question and answer. But where I really want to focus on, again, is the behavioral and what we're seeing a lot of organizations, a lot of companies really having to navigate their staff and their employees, as well as visitors, clients, customers, et cetera. So it does kind of go back to that, what is the maximum occupancy that a building or a space can really handle? We're seeing this a lot in restaurants, of course, mitigating the capacity. But it's really ensuring, whether you're an administrative office, kind of typical workplace functions, kind of shifting, your approach, whether it's a management approach or expectations of employees in terms of their need to come back in, as well as really making it very clear what the building's expectations are, and if you're a tenant, just in terms of the behavioral modifications. And I think everybody has experienced this at some level. When we talk about change management, it's about protocol, behavioral protocol, etiquette development, or it can be as simple as the signage. A mask is required to enter. And as we know that in some cases, those behavioral protocols have become a bit controversial, but it is important that it's very clear. So we can go to the next one if we could. So specific, I get a lot of questions about workplace specifically, and that's some of the questions that we'll get into later on have emerged, but I'm going to run through this quickly just to let the others give their introduction and get to a dialogue. I think we can go to the next one as well. Again, this is something that we can make available to everyone. But one of the things that we are seeing, there's the immediate need to get back into the physical space or to, again, maintain those critical on-site staff that are already there, and then managing that with the folks that have been able to and will continue to be able to work remotely. And so really what we've been seeing is, about a decade or two or so ago, the purposes of our offices changed. Once technology enabled what we call internal and external mobility, people to move around, the purpose of the space changed. And yet again, we're seeing it change yet one more time. And so, we understand that mobility has always been an option, but now it's a requirement, quite frankly. I think we can go to the next slide. And so, again, going back to our buckets, operational, behavioral, spatial, it's a lot of questions about kind of occupier comfort, people being comfortable or feeling comfortable going back to the space. It's really critical that anything an organization or building has done is conveyed and communicated as visibly as possible, so that those that are coming back understand the steps that have been taken by a company or a building to make them safe. And I can't emphasize that enough. I think we can go to the next one. And so again, in very pragmatic steps is, what we've been advising, we've been helping clients with, and what we've seen a lot of organizations is create that playbook. There's a lot of resources out there, but really what is that action plan? If you're an organization, a large conglomerate, what is your governance structure, your decision-making structure? How do you cascade decisions throughout your organization? If you're a small privately owned business, maybe it's just you, but what are the resources and the references you're tracking? How are you updating and mid-course correcting? And then you get into the partial reoccupancy. What is that kind of phase one, phase two? We've been seeing a lot of folks, 10% only in at once, 25%, et cetera, and constantly monitoring how it's going. And of course, the step that we're all looking forward to is the sustainable reoccupancy, which is the longer term and whatever that kind of new normal is. But again, ensuring that there's an engagement process and communicating and checking in with all the occupants to make sure that, if you have to mid-course correct, if you have to adjust, that's happening in real time. And I'll turn it back over to you, Bill.
Thank you, Kelly. That was terrific. I'm going to quickly go on to our next couple of presenters, and we're going to have some Q&A afterwards for everyone. It's now my pleasure to introduce Benjamin Kim with the Global 100 law firm of Nixon Peabody. Benjamin is a partner at Nixon Peabody in the Labor and Employment Group. He co-chairs the firm's Occupational Safety and Health practice. He represents clients in a range of industries in employment and labor matters in both federal and state court litigation, and counsels employers on a wide variety of employment issues. Ben, the platform is yours.
Thank you, Bill. I've been told that these headphones make me look like a nightclub DJ. So with that, thank you for that introduction to make it very clear that I have some background in what I'm talking about for our practice here, which is national, but I am based in LA, so I'm very familiar with LA and LA County. I think it's really important, and just to kind of build on the very important points that Kelly mentioned just now, are what's the legal liability in this? And we can think about workers' comp, which is a big deal in California, right? And they're in California. Currently, there's a presumption that if you've worked recently for your employer, that there's a presumption, it's rebuttable, but there's a presumption that you got it at work or it's work related. So it's a pretty big presumption, and one that could have a lot of effects on the workers' comp system. So if we want to move to the next slide, what I really want to talk about, which is my background, is occupational safety and health. And the reason for this is that irrespective of what happens in the workers' comp system, right, because that's going to be covered by workers' comp benefits, your workers' comp insurance carrier, and the process will work itself out in terms of whether or not something's work-related and what the compensable type liability will be ultimately. OSHA is a different beast, and so irrespective of what happens in workers' comp, you have the Occupational Safety and Health Administration, Occupational Safety and Health Act, which requires, as you can see on this slide, that there's a general duty clause. It's a general duty to basically keep everyone safe. And federal OSHA has enforced the general duty clause in a lot of different ways. And COVID-19 will likely be the next area where, and already has been an area in which they've been focusing on the general duty clause, as well as other specific industry-specific or task-specific regulations. They use this general duty clause as sort of a catch-all. So it's important to keep in mind that OSHA has this general obligation to keep everyone safe. California also has a general duty clause, although Cal OSHA does not enforce the general duty clause. Instead, they have to create specific regulations. And we haven't seen any specific COVID-19 related regulations come out, but there are things like, for example, the regulations requiring you to have a written safety program. And part of COVID-19 and the return to work strategies, much of what Kelly just discussed, should be part of that written workplace safety program. And so I want to talk about that in a few minutes on the next slide. But before I get there, I want to focus also on OSHA anti-retaliation and what is protected activity, because I think this is going to be your next big area of potential litigation, right? Because you're going to have a situation where people are going to be returning back to work. And as Kelly mentioned, people might have reservations. There might be concern about their safety and health. So what are you going to do to help calm those fears, right? Because if someone believes it's unsafe to come back to work and they refuse to come back to work, and you, let's say, terminate them, discipline them, take other types of adverse employment action against them, that potentially could be retaliation under OSHA laws, right? And so what you really have to drill down on is it protected activity, right? If someone doesn't want to come into work, doesn't want to come into the office. And that is based both on a subjective belief and an objective belief. So, so this is really about what is someone's mental state, and what have you done to communicate all of your various strategies to allow for the safe return back to work. And so let's go to the next slide about how, there's the framework for analysis. Obviously, these are the key steps in terms of how do you mitigate your legal liability. It's impossible with COVID out there, community-wide spread of COVID-19, to eliminate the risk entirely. The hazard is out there, people know about it. And so what are you going to do in response? And these are the steps: compliance, obviously, with governmental orders, compliance with public health guidance. Now, in some cases, public health guidance is just guidance. In other cases, it's an order. So for example, California recently is now requiring face masks statewide. Certain counties had been requiring that here and there, but now it's a statewide requirement to wear facial coverings in common areas and in public places. So you've got to work that into your return to work strategy. And then we'll talk about on the next slide, critical steps in advance of reopening. We'll get to that. And then executing the return to workplaces is also going to be key. Following through with what you are going to communicate with your employees. And then finally, how do you maintain that safe and healthy work environment? So let's move to the next slide. I want to spend a few minutes here before I turn it over back to Bill. So you've got to figure out who you're going to determine, who you're going to bring back to work and when. And that will be different for everyone. And you've got to figure out, and I've had employers contact me with these questions, and it's really different depending on your industry, depending on how your workforce is set up, how comfortable and how productive people have been working remotely, people who have been either furloughed or are not able to work remotely. Should they have priority in terms of returning back to work? It really just depends. The second aspect of this, the second step is really important as well, which is your hazard analysis. The hazard being COVID-19. And basically taking a look at your work environment, whether it's an office space, facility, plant, and what are the potential risks of spread, exposure, what are the various touch points, and really just breaking down and looking at all of the potential risks of spread of the disease, of exposure, and how do you address each of those risks. Now, it's important because when OSHA comes and investigates, they're going to want to see documentation of this. Where are your records? So it's important as you're doing this analysis to keep records of what analysis you're doing. What risks are you seeing? How have you addressed those risks? Perhaps there are things that you thought about but decided that is a extremely low risk, and so you're not going to address it specifically. Maybe there are things that are higher hazard, higher risks, and you want to address those specifically first. So you really want to document this process so that if it ever comes into question, whether it's through OSHA or through litigation or through other liability, if you can show that, hey, we took reasonable steps to look at our work environment and break down what the potential risks are. The third step is figuring out what your procedures are going to be. How are you going to update them? So, for example, I do labor and employment, right? And in California, we all know about meal periods and rest breaks, right? So you might have a situation where typically pre-COVID, you had everyone taking their meal break at the same time. Now, post-COVID, even with reduced office occupancy, you've got to be careful about saying, hey, we're all going to take our lunch break at the same time, because that might overcrowd the kitchen or the common areas or the restrooms. And so you may want to stagger those meal periods as long as they comply with the meal period laws to make sure that they're timely. But you may want to stagger them now. So that's an example of how you may update a previously written procedure in maybe your handbook or some other separate meal and rest period policy. You may want to update those given what the potential risks are in your work environment. Other considerations to think about. I've received a lot of questions about what do you do when vaccines are available and what do you do about screening and testing, such as temperature screening. I can't say there's a consistent answer one way or the other about testing or temperature screening. And what I mean by testing, I mean COVID diagnostic testing. Do you want to require that before coming back to work, et cetera? Generally speaking, what I've been recommending to people is having people verify that they've taken various steps, right? That by coming into the office each day, they're verifying that they're not exhibiting any signs or symptoms of COVID-19, that they haven't been notified that they have it, or they haven't been notified they've been exposed to it. And so, a lot of this, again, is going to be the devil's going to be in the details, but this framework will help sort of break down and make the process consistent for most workplaces. The last couple points are important. I don't want to brush them over. Communication in advance of reopening. This goes back to the potential retaliation claims, right? It doesn't do you any good to communicate these things on the first day that everyone's back to work. You got to do it in advance, and you got to do it in advance enough so that you give people time to process it, digest it, and then potentially train employees on these new procedures. You may think, well, washing hands, we don't really need to train people on that, or wearing face masks, we don't really need to train people on that. you might have to, depending on your workforce, depending how much you're going to rely on those methods, procedures, how to clean your work environment, how to clean your personal space in your work environment. Those are some examples of things you might want to train people on. And then lastly, and this is very important, enforcement, right? It also doesn't do you any good if you have a lot of people return back to the office and no one's enforcing your procedures. So what you're going to end up getting is a lot of complaints, maybe even to OSHA, that no one's doing anything about COVID-19. And even you can go to OSHA and say, hey, look at all our great procedures that we have in place to protect people. And then your employers are going to say, well, no one enforces it because I see people sitting next to each other in the lunchroom. I see people talking without face masks on, holding in-person meetings regularly, right? So the enforcement, how you're going to enforce, who's going to be in charge of enforcing these procedures. All of that will be really important in maintaining a safe and healthy work environment, and to avoid potential complaints down the road to governmental agencies, and hopefully avoid litigation. So with that, I'm going to turn it back over to Bill. Thank you for your time.
Thank you, Benjamin. That was terrific. As Kelly identified, the post-pandemic office is quite different than the pre-pandemic office, and Benjamin's given us a great outline of steps that we should take to mitigate any potential legal liability and ensure the health and well-being of our employees. And as part of that, they both identified the need for clean, safe, sanitary environments, and a number of our business assistance clients are asking us for help. Where do they get this help? How do they get the safety, cleanliness, sanitary conditions that they need? And so it's great that we have our next speaker with us, Neil Bernstein, the Director of Strategic Accounts at LA's own Servicon Systems. Neil has over 30 years of experience in the sanitary supply and service industries. Before joining Servicon, he served 14 years as a partner at Access Partners, manufacturers representatives for the janitorial industry, where he specialized in the healthcare and building service contractor markets. I should point out he's a certified trainer in a number of specialties in the industry, and he has served as president of the Southern California Sanitary Supply Association. Neil, the platform is yours.
Thank you, Bill, for that wonderful introduction. Kelly, I have to thank you for setting the table so nicely, because you had mentioned there's so much misinformation. So hopefully a little bit, some of the slides I have will kind of help folks get some clarity around what to do and how to do it to make sure that their facilities can be clean and safe and COVID-19 free as much as possible. Shane, why don't you go ahead. Just a quick note about Servicon. We've been in Culver City since the mid-'70s and really focus on a couple of key markets for ourselves. Aerospace is a big market for us. Healthcare is very important. And then lastly, we do some work in the commercial building industries, single and multi-tenant types of facilities. And it really gives us kind of a unique perspective of a variety of different people that we partner with. A couple things that we've really worked, and I would encourage everyone to do, is really engage in a partnership with your vendors. We have partnered with our clients really to take a look to make sure that they are attuned to the CDC guidelines, to make sure that they have the best recommendations for cleaning for health, and of course, really looking with them to make sure that their statements of work are in line with COVID-19 protocols. It comes down to four things: people, process, product, and now the new one is perception. And again, Kelly, thank you. You talked so nicely about change management, because that's really a lot of what perception is all about. So, fantastic. One of the things I really want to get around everybody is make sure that you really develop a solid, cohesive, and a well thought out plan. What needs to be disinfected? What areas? What high touch areas? Did we do that before? Do we need to do it now? What's the path of travel? Right? Benjamin mentioned lunch areas, or people, where are they taking their breaks? Are there different areas than they did before? So based upon that, you certainly want to determine what areas need to be disinfected, how often they need to be disinfected, and of course, lastly, concerning the resources, the products that you need, the equipment that may be needed, and of course, the people that might be needed. And again, that's very important, because adding to our scope of work, changing our scope of work, this is really important when we talk about the resources that you need to go, because some of these things may have some pretty large budget considerations. Shane, fantastic. Very good. From our standpoint, at Servicon, we've kind of lumped these things into 3 broad categories that I think is really good for everyone to kind of really look at and talk about. So I'm going to kind of break this down into talk about how we've done this and how we've got to go about and we've discussed with our clients. But this is great information to talk to your clients and your vendors and your janitorial folks about as well. Number one, we just talked about protect and sanitize. If this is the daily disinfection of your high-touch areas, very simply is that, what areas, much like I just talked about, what areas need to be disinfected and when? The second portion is if somebody goes home sick, they may show symptoms. Are we going to have some additional resources pointed to those areas in a precautionary measure to make sure that that area is disinfected, maybe to a higher level, to a different level, more surfaces, etc. And of course, lastly, what happens at your site if somebody turns out to be positive? How do we handle that? Do we bring in an outside firm to disinfect the whole areas? Are we going to try to do it with our own people? What protocols do we have into place? And again, this really should be part of your plan, because at Servicon, what we've really instructed our clients to really think about, this is where you need the outside folks. This is where in the upper right-hand corner of the slide, I've got somebody in that's fully suited up. We separate the area. We use electrostatic sprayers, air scrubbers to make sure that that area is free and clear of any viral spores, as well as making sure that air is clean as well prior to leaving that area that might have become infected. So again, those are a lot of things to really think about as part of your overall plan, and to make sure you partner with your vendors and some things to really ask them very poignant questions to make sure that you've got things covered prior to any of these things happen, so it doesn't turn into a Chinese fire drill. God forbid that it does. Shane, why don't you move to the next one? We'll tell you what, let's move into some really the more poignant details of what you should be doing at your facility. And again, a lot of things and some resources to look at. So disinfecting. A lot of folks aren't really sure what it is. What is disinfecting? Well, disinfecting is making sure we kill all of the viral spores, bacteria, etc. And that's the definition of disinfection, is killing all of the bacteria, viral spores, etc. On the back of the label, my best suggestion is to read the label carefully. Kelly pointed out so nicely that there's a lot of misinformation. By reading the back of the label, it will give you all of the information that you need to make sure that you apply that product and that you use it, what PPE that you might need, any hazards that might be applicable towards that product. I would really suggest that you read those instructions. One of the items that's going to be on those instructions are things like dwell time. How long does the product need to sit? Because disinfection that product needs to sit on the surface for some time so it can be able to kill all those viral spores. Well, some products might have 3 minutes, some products might have 10 minutes. All of them will have something. By spraying it and wiping it immediately isn't going to do a whole lot for you. Secondly, used products are only on the list N of the registered disinfectants. This list is easily available from the EPA. I get a lot of products across my desk that they say, or ask, is it registered with the EPA? And I get this long pause. Well, if it's not on that list, my suggestion is don't use it. If you aren't sure, ask your vendor a lot of questions regarding that, because if it's not on that list, it's not applicable to use for this product. Choose your product carefully. Many of these disinfectants are really not made to be used in an office environment. They're really made to be used in a hospital. So my suggestion is, before you just start spraying different surfaces, it's very possible that these products could cause some damage to the substrates. So I would really suggest to make sure that you really investigate the products that you're using very carefully. My best suggestion for you is not to use bleach. Sodium hypochlorite is not a great product to be using. Ask the folks that were using it at Appleby and caused if you mix bleach with many other chemicals, including many other acids, it can cause a lethal gas. Not a good thing. Okay, so my suggestion is bleach is not a good product to be using. If you want some recommendations, please do the Q&A. I'd be happy to give you some other recommendations. 4, use microfiber or synthetic cleaning cloths. Don't use cotton or natural fibers. Many of these disinfectants are not made to be used with them and make the disinfectants inert upon using a natural fiber cloth. Microfibers are a great product to use. Lastly, none of that matters if we don't handle the basics. And you've heard this 100 times, but of course, wash your hands, don't touch your face, practice social distancing, wear your mask when applicable, and of course, if you're showing symptoms, stay home. Because we can disinfect those surfaces all we want, but as soon as I cough or sneeze on a surface and other people are touching those things and spreading those viral spores all over the place, it really doesn't matter. Lastly, just some resources. And again, these are websites that are readily available from the CDC and the EPA. I'd implore you to check them out for the guidelines. And if you need any help navigating them, again, we're happy to assist. Thank you very much. Bill, I'll hand it back to you.
Thank you, Neil. That was terrific. Appreciate those very specific suggestions. I want to take just a moment to introduce my colleague, Barbara Levine, who's our Senior District Manager for Economic Development and Business Assistance. Barbara has been providing strategic consulting services to businesses of all sizes, primarily in the southern parts of LA County for more than 15 years for our organization, is highly regarded by those small businesses for helping them in good times and bad. I'm just hoping she'll share a couple of her recent conversations and some of the work that she's doing before we get into the Q&A. We've only got a couple of minutes, Barb, so we can get into some Q&A, but please welcome Barbara Levine.
Thank you, Bill. Okay, Business Assistance Program, we've been very successful and we've helped to attract and retain over 244,000 jobs in LA County since 1996. We provide the personal attention. I think that really makes a difference with the businesses that we serve. It's the personal attention, especially now in the COVID and going into the post-COVID world. We're business professionals and I have a background in consulting. Under the COVID order, or since the COVID order, we have been providing a lot of assistance, a lot of listening, a lot of activity, and working tirelessly just like you. Our business assistance calls have more than quadrupled. We've assisted more than 1,000 businesses at risk in LA County, more than 200 in the city of LA. The top 3 business challenges, funding. Where do we go for additional funding? How do we reapply for an EIDL? How do we fight the denial on the loan? What about workforce and any programs through EDD? And what about strategies to contain costs? And we're also going into the safer at work compliance and strategies for success that we're speaking with businesses. And just as a gentle reminder, you know, about the consulting that we do with businesses, a lot of it is financial. Quick reminder, the Payroll Protection Program application period ends tonight. There is a new phase of the EIDL, the Economic Injury Disaster Loan, that opened June the 15th. There is also an economic injury loan for businesses that were impacted by the unfortunate civil unrest. And we have newly announced last night a program between the County of LA and City of LA for a grant program. And I'm happy to answer your questions and be part of the panel. Thank you.
She and her colleagues in our Business Assistance Program and our Community Connectory can be reached through our laedc.org/coronavirus resource page, where you'll find a lot of resources from our presenters today and from others in our region who are helping businesses get through this pandemic and recover and reinvent themselves for long-term sustainable success. We have a few questions for our panelists, and I see a few coming in live. I just noticed there was a pre-planned question here that has also come in live from others, which is really about testing, the importance of temperature testing now, not necessarily COVID-19 testing, but temperature testing. Is it required in workplaces, and if so, who should administer it?
So, quick note about temperature testing, temperature screening, or body scanning, right? So they're coming out with equipment that can scan your body temperature as you're walking in. It's not required, generally speaking. Healthcare might have specific requirements, but generally speaking, typically it's not required. It's not even recommended necessarily, because, and here's why. Temperature screening, it needs to be administered correctly. If not, you could get a wrong reading. Even if you aren't showing a temperature or a fever, you may still have the virus, right? Because we have heard plenty of stories about asymptomatic individuals. So the effectiveness of the temperature screening isn't great. Now, who administers it? Good luck trying to find an employee who wants to do the temperature screening for all your other employees. But if you do have that person, volunteer, make sure that they're trained properly. They are wearing appropriate equipment, gloves, N95 masks, face shields, and that they have been trained adequately to perform the procedure, which, by the way, is considered a medical exam now. So any information that you collect is medical information and subject potentially to the California Consumer Privacy Act, the CCPA. And so what I have seen, a lot of employers in LA say, is that we don't want to touch this with a 10-foot pole. We may have an outside contractor do it if there's a significant demand for it or pressure for it. We may hire an outside vendor to take care of it all for us. But then you have, okay, what do you do with people waiting in line to be temperature screened, right? For your hourly employees, they have to be on the clock, right? Because they should be on the clock for that, right? So it just creates all sorts of issues. To answer your question, if you do decide to do it, you've got to make sure the person is appropriately trained, that they're wearing the appropriate equipment, and that they're administrating it correctly. Now, all of that aside, documentation, right? Do you document it? Do you record it? Do you keep it, right? And there's no clear standard on record keeping when it comes to temperature screens. So again, devil's in the details. But yes, it is an option that's available. I have some employers who are willing to do it, who want to do it, not just for their employees, because also for third-party visitors, right? Because if you're going to do this for your employees, why aren't you doing it for third-party visitors? If you're doing it for your third-party visitors, why aren't you doing it for your employees? You're going to get those questions. Consistency is really important. It goes through the mental aspects that Kelly talked about earlier.
And Benjamin, beyond the temperature testing, what about the PCR testing, the actual COVID-19 testing? Is that recommended for workplaces, large or small?
So there has been, so basically the government agencies have come out and said, we can see a business justification for doing these medical exams, right? For requiring these medical exams, but they haven't gone on to recommend them or bless them in any other way, right? They're saying that, okay, we understand, because typically if you're going to require a medical exam, there has to be a business necessity. And they say, well, given the pandemic, there's a business necessity. So you can do it, you just have to be very careful if you do it. Now that said, let's go back to the effectiveness. Just because you get tested today and say, I don't have COVID-19, doesn't mean you're not going to get it tomorrow. Doesn't mean you're not going to get it during your lunch break. Doesn't mean, right? So, so are you going to test people every day? Or, so the effectiveness of this testing really comes into question, right? Because again, it's not really going to protect you moving forward. You have people coming in the office 5 days a week. You're not going to test them every day. And what if they pick it up at the grocery store or the hardware store or, a restaurant that just opened up in LA? So, or the beach in 4th of July weekend. So, so it's not required, it's not recommended, but it is an option available.
Thank you, Benjamin. For Kelly, we have a question. Can you share some lessons learned from your recent work with public sectors, such as cities and counties?
Yeah, so we have a broad array of types of things that we've been doing with organizations, both public and private, really along the same lines of that very simplistic kind of operational, organizational, behavioral. I think that I can't yet share it publicly, but any day it's going to be posted publicly. We helped with the Canadian federal government with their broader overarching playbook, right? Something that is going to be going out to all of the federal agencies, a really straightforward, a summary that I believe, takes into account the Health Canada guidelines, all the really technical, the CDC, the World Health Organization, as well as their facilities maintenance, and all of these, 2 or 3 reference documents that are over 100 pages each, and we've been able to summarize that in, to make it tactable and palatable for the various agencies, whether you're a small underfunded agency versus, one of the large DoD type agencies that has thousands of employees, as that starting point, right? To, what is that, plan that Neil was talking about, and what is that, what are those steps that I have to take, and how does that apply to my agency? So that's something that hopefully we can distribute within the next few days. It's being socialized there, there being Canada. And one of the other things that we've done is really, again, and I think it was Benjamin that pointed out that the CDC guidelines are very much that, they're guidelines. And, there's not necessarily a level of specificity, and maybe in some cases intentionally so, but kind of taking that guidance and how do you apply it for the different space typologies. And that's something that we did for the city of Pasadena, where taking that guidance, but how do you apply it to retail typologies, to restaurant typologies, to administrative office typologies, and really just kind of making those tactical steps from like broader recommendations to having recommendations or suggestions for specific typologies. And really the other thing that we've done for Pasadena and we're doing for others is helping prioritize, right? I mean, everybody's making these decisions in terms of mitigating risk. It's all a big risk mitigation because, as we've heard today, there's unfortunately no 100% foolproof solution in any sector. So it's, how do you prioritize these decisions? How do you coordinate? I mentioned previously the governance structure. How do you weigh your own organizational context, with the guidance that you're hearing out there? So, and then the final thing that we've done for Pasadena and other cities, the city of Chicago, DeKalb County, Georgia, is creating some of that communication strategy. Again, these are the very extensive steps we've taken as a county, as a organization, as an institution, making sure that's visibly displayed, both the behavioral expectations that I mentioned, as well as these are the things you have to do when you come into this building, wear your PPE, this or that. And actually to Benjamin's point, or maybe it was Neil, forgive me for getting that mixed up. It's like, what is that ownership of that standard operating procedure, right? It's great that you have a game plan, but who is the one that's kind of responsible for making sure people are following, and how do you update it if they're too complex or whatnot? And so that's a big thing that we're starting to do with our federal government in terms of the behavioral protocol and then the management of that.
Terrific. We've had a couple questions about masks. There's been a lot of news coverage lately on the legalities of enforcing masks and the ADA. What is the legal background on this? Are businesses within their rights to refuse entry to someone not wearing a mask or adhering to screening and testing requirements? I guess that's for Benjamin.
So currently, California is requiring masks. And so I think you've got something to rely on there and say, hey, it's not us, point to Gavin Newsom. Now, let's say you have a worker who says, I can't wear a mask because I have a pre-existing condition, medical condition that will affect my ability to wear the mask for prolonged periods of time. So you've got to go through your typical reasonable accommodation process to accommodate that medical condition and or disability. Whether that makes sense, whether it's on an undue burden, all these things, that type of analysis, you got to work with your employment counsel, your HR manager, your HR consultant to manage that situation. But generally speaking, as a business, you can refuse entry because it's a statewide order. Now, it was a question when it wasn't a requirement in LA County or statewide. And so, businesses have had to weigh the pros and cons and the risks of doing it and not doing it. But generally speaking, as recommended throughout, wearing facial coverings is generally accepted. It is generally promoted by the scientific community. So I think you are taking on potential risk for not meeting your reasonable duty of care if you are not following what is generally acceptable, safe and healthy practices.
Thank you, Benjamin. There's a question about the grant that I think Barbara mentioned that came out yesterday. My guess is this the County and City Collaborative Grant Program. Barb, do you have any information on that? If you do, please share it briefly. And if not, I know we have it on our website at laedc.org/coronavirus.
Well,
Barb?
Bill, as a matter of fact, I do. Because
Fantastic.
Supervisor Ridley Thomas, bless him, sent a media release last night as well as some other sources from the county. It was just released. They're hosting a series of webinars, I think today, tomorrow, and Thursday, so check the website. LA County and LA City have partnered to provide $5,000 grants to micro entrepreneurs, $15,000 grants to nonprofits and small businesses, and to ensure equitable access across all demographics throughout the region. Grants are going to be distributed through an equitable lottery system. So I will be learning more about this because this was just released last night.
And we'll be posting on that community connectory of ours at the laedc.org/coronavirus the links to be able to apply for that. I'm going a little bit over our time here with the permission of our panelists, just a couple of more minutes because we've had a number of questions. A couple of specific questions. I think, again, they're legal questions. What do we do if we discover an infected employee in the workplace? For Benjamin?
Wow, I wish I had another half hour to talk. This goes back to having a playbook, as Kelly mentioned. What is your playbook? What is your procedure going to say about the? Now there are, depending on your industry, there's CDC guidance, there's OSHA guidance, but generally speaking, if you are told that you have an employee who has COVID-19, you've got to go back and figure out, okay, where was the employee? Who did the employee come in contact with? Got to make adequate disclosures to others who may have been come in contact with that person. You have got to question and analyze whether or not you need to shut things down. So you do a deep cleaning, depending on the situation, depending on where the employee was, et cetera, or shut down that area, close off the area until it's deep cleaned. So it depends on when you're notified. Testing sometimes isn't available. The results aren't available for 24 hours. So a person may not know. And then all of a sudden they say, oh, well, I just got tested. They're not sure how long they've had it. They've been in your office for a week, right? So now, where have you been the last week? You've got to go through all that analysis. There's a procedure in place. You can't be perfect. You cannot leave every stone unturned. That's not reasonable, right? It becomes an administrative nightmare. But you've got to take reasonable steps. And I think most people would contact trace, communicate, shut things down if necessary, do a deep clean, et cetera. What do you do about returning people back to work? That's another question, which will take another half hour to answer. But I'm boiling things down. Yeah.
No, I appreciate that. And I want to let all our participants know that the webinar is being recorded. The presentations will be available. There are several links we provided in the chat box. All this will be available on our website, I believe, as soon as tomorrow, again, at the laedc.org/coronavirus. We've heard really wonderful presentations this morning. We went a little over our planned 45-minute time because there was such quality content. We wanted to get to a number of your questions. I want to thank Kelly and Benjamin and Neil and Barbara for their presentations, for the great work they're doing through their organizations to help us all responsibly, safely reopen so we can protect our workforce, we can protect our customers, we can protect our families and our broader community. And we've all suffered a lot of pain through the impacts of the pandemic since early to mid-March. And we're seeing now, if we don't follow these protocols, if we don't have playbooks, if we don't communicate effectively, we won't be able to stay on this path of reopening. We've already seen what's happened with the bars. Hopefully that will get straightened out and reopened sometime soon. But safety must come first. We're in a safer at work ethic now. We were in a safer at home paradigm for the last few months. Please take heed to the wonderful advice you've received from our speakers today. Share the word, send people in your networks links to our site and all these various resources so that all of us can be armed with the necessary information to be safer at work. I'm going to turn it back to Shane Cullen, our Zoom master, and thank you all on behalf of all my colleagues at the LAEDC for your attention to our presenters today and your support for our mission of advancing opportunity and prosperity for all of the residents of this region as we reinvent our economy and the businesses who make it up.
And with that, everyone, thank you very much for joining us. As Bill said, we'll have all these links to you later in the week. And please do visit our website at laedc.org/coronavirus. And please feel free to email us with any of your questions. Thank you very much and have a wonderful week.
Thanks, everybody.
Thank you, everyone.